Hi, welcome to week 2. Let's go ahead and get started. So, this week we're going to build on some foundational understanding of what factors help make effective psychotherapy. So, all approaches to psychotherapy in the most basic form is delivered between a therapist and a client, so requiring some form of interaction. It's how these interactions are delivered and utilized that's how we can determine whether treatment will be successful. The important element of successful treatment is the interpersonal relationship or therapeutic alliance between a therapist and a client. So, I want to focus a little more closely on the importance of the therapist and client relationship and the influence it has on effective treatment. It's been estimated that at least 30% of patients' improvement can be attributed to relationship factors. That's a lot when you think about it. That's saying that a third of a client's improvement is dependent on the relationship you nurture with a client. So, a strong interpersonal relationship tends to lead to a strong therapeutic alliance. And when I say therapeutic alliance, I mean a bond of attachment that's created between a client and therapist, where the client identifies the therapist as a kind, tolerant figure that allows for interpersonal attachment. You can work on building this alliance by establishing a collaborative environment and good atmosphere and creating mutual agreements on the goals and tasks of therapy, as well as helping nurture mutual trust and acceptance. Other factors to consider when identifying what makes psychotherapy effective are patient variables and placebo and expectancy effects. I'm not going to spend a lot of time focusing on these specific ingredients, but essentially, patient variables refers to the severity and number of symptoms that the patient presents with and their ability to understand their presenting challenges. Also, their social supports and resources, and this can vary from patient to patient. Placebo and expectancy effects refers to the strength and impact of placebo and expectancy effects have on the treatment outcome. So, placebo in this sense is not necessarily associated with treatments that have no active ingredients like you would see in medicine, but an understanding that the treatment experience for patients, regardless of what form it takes, can have a positive impact on the treatment outcomes. Next, I want to touch on mentalization and mentalizing and its commonality in psychotherapy. So, mentalizing is the implicit or explicit perception or interpretation of the actions of others or oneself as intentional, that is mediated by the mental states and mental processes. So, in fewer words, and at its foundation, mentalization is the ability to think about thinking. It's the act of making sense of our thoughts, beliefs, feelings, conceptions, and linking them to our behaviors or actions. It's believed that this process of mentalizing is a guiding construct, I would say, that underpins many different therapeutic approaches, including brief therapy. So, 4 strong arguments in favor of mentalization being a key part of effective psychotherapy are controlled and um, explicit mentalizing is a core aspect of all therapies, meaning focusing on and understanding behaviors and providing understanding on how to manage that behavior. Also, psychotherapy activates the attachment system, which facilitates a myriad of relational processes. Also, therapists and clients will continually construct and reconstruct in their own minds an image of the client's mind, which means labeling feelings, understanding cognitions, and exploring beliefs. Finally, the dyadic nature of therapy fosters the client's ability to have multiple perspectives. All right. So culture is another area we're going to touch on, and it's an important aspect of ensuring psychotherapy is effective for clients, and that as therapists, we are being mindful and culturally competent. So, what is culture? The DSM-5 defines it as a reference to systems of knowledge, concepts, rules, and practices that are learned and transmitted across generations. So it's dynamic and it's constantly changing, and it's a process of making sense of an experience. It affects how one communicates, implicit rules that a client uses to share their narratives and challenges. And it really influences how a client views acceptable treatments. Therefore, as we discussed earlier, how important the therapeutic alliance is to a successful treatment, it's important for a therapist to be able to understand their client's cultural associations. Some therapists may choose to integrate the cultural formulation interview into the assessment or intake process. This is a great tool to help understand how a client views their challenges through their own cultural lenses and it helps the therapist in building cultural competency and a strong therapeutic alliance with the client. So, completing the CFI can assist with understanding how therapists might need to adapt a psychotherapy model to meet the cultural needs of a client. This can be as simple as facilitating an intervention in the preferred language of the client, for example. All right, and last but not least, we'll talk about incorporation of medicine or medication with brief therapy. For some patients, the use of medication in addition to brief therapy allows for and even accelerates the change process. Many reviews have shown the effectiveness of combining medication and psychotherapy, especially for short term therapy models. So, noting the combination is often better, that it's often better than each modality being offered individually. So, collaborative care with a prescribing physician who would be prescribing this medication, or any other client, someone on the client care team, is important to ensuring proper symptom treatment, goal adherence, and facilitating the change process. All right, that's all for this week. And next week, we'll talk about narrative therapy. Thanks. Have a good week.